WisconsinEye is interviewing those officials on the front lines of the COVID-19 pandemic and the response. And no officials are, now that the Safer at Home order has been struck down, are more on the front lines than county executives. So I want to thank County Executive Joe Parisi of Dane County, County Executive Paul Farrow of Waukesha County for joining me for a civil dialogue. Seems to me that both of your counties have had slightly different responses to the Supreme Court ruling. So gentlemen, thanks very much.
My pleasure. Thanks for having us.
Yeah, thank you.
Let's just have some stats. You guys, your counties make up 16% of the state population. And ironically, that's almost exactly the population of Milwaukee County, but Mr. Crowley isn't with us today. You've had a total of 50 deaths in your counties, 26 in Dane, 24 in Waukesha. You've had 563 positives in Dane, 514 positives in Waukesha. So that's just by way of setting it up, and we'll go back through some of those stats later. But I want to start out the show this way: the role of state government. When a state like Wisconsin is faced with a pandemic like COVID-19, which, let me look at the DHS stats, 154,000 negatives, 13,413 positives, 481 deaths, tragically 55% of them in Milwaukee County. What is the role of state government? Is it the role of state government to come in first, line of first defense, and counties wait on the state response? I'm sorry for the length of that question, but please, gentlemen.
Well, I think when you look at the role of government, especially in emergency operations, is to be able to stand up resources for the areas that are impacted. When the emergency order was declared by the governor on March 12th, we weren't sure what that was going to be. So the statewide order, covered everything. And as County Exec Parisi and I both did, we had our own individual emergency orders that then allow us a kind of a broader scope of what we can do within the counties. And I think the approach to begin with was very good. When you look at the impact, we weren't sure what was going to happen. We wanted to be able to have the resources that we needed. The way it was done in March and the way it was started up, I think was a great opportunity and a great process the way it should be done.
Joe, please.
Yeah, so ideally, I think all units of government should be able to work together in partnership, be it the federal government, state, or local. And to a certain extent, we're able to do that. It's been a little more challenging with the federal government. But I think the ideal situation is if the state can issue a set of guidelines that provide a baseline, because obviously when we're dealing with something as serious as a pandemic, a virus knows no borders. But then, frankly, allow regional areas to exceed the baseline that it puts down and to adjust. You have somewhere like Milwaukee, like Dane County, so that we at least have a baseline. Because the challenge that we're having now is that when the statewide guidelines were struck down in the manner in which they were, it really just flung the doors wide open and created chaos across the state. And so you have counties like Dane who have orders in place, and the neighboring counties that the doors open and the bars packed. It creates a very chaotic situation, and frankly, a very dangerous situation, because people who pack into those bars can cross the borders and come into Dane County. So I think the ability to have statewide guidelines in a case like this is critically important.
Well, I'm going to follow up on that. At the time of the governor's first stay-at-home order, had state government partnered with key county executives like you, since you both lead large counties, to give you enough information to justify the first safer-at-home order? Paul, do you want to go first, and then Joe?
If you're asking, did they call us and say, this is what we're thinking about doing? I would say no. We had conversations that we tried to reach out to find out what was going on. I had one conversation with Governor Evers shortly before the March 18th order and asked what they were looking at, what they were planning on doing. And at that point, they really didn't have an answer of what they were going to accomplish or what they were looking to set up. Yeah, I think the challenge is, as County Executive Parisi was saying, communication is very important. And it's important that we have the right information as we're moving along. I agree with him that the COVID virus doesn't know any borders, but I guess the challenge that I go back to is when you look at who's impacting at the point of a result, there are things that we're doing in Waukesha County that are having positive results so that we can keep an eye on what's going forward. We try to get that back to the state, and we get very little interaction that occurs getting the knowledge back and forth.
Well, very quick, thanks for your patience, Joe. Very quick follow-up, Paul. At the first safer at home order, are you saying then that you were not convinced it was justified because you didn't have enough information?
At the point in time, I didn't think the scope of the order, the way they had written it, was still a justifiable scope.
Okay.
I thought I understood why they were looking at asking people to stay home. But again, I kind of go back to the essential, non-essential businesses. The way they set the parameters up and the reasoning that they were looking at didn't jive with how they were going through on the process.
Okay, Joe, the same question. The original safer at home order justified, sir?
Yeah, obviously we're all learning as we go. This is something that no one in our generation has had to deal with. And as a matter of fact, if we look in the rearview mirror, a study was just released this week that showed if nationwide we would have shut down a week earlier, that could have saved an additional 34,000 lives. 2 weeks later, could have saved an additional 84,000 lives. It's almost like the opposite of compounded interest, where the earlier you invest, the better you do in the long run. Again, that's hindsight is 2020. In Dane County, our case was a little different because we were the first county in the state and the 12th in the nation to have a positive COVID test. So the silver lining in that is that we sprung into action early and earlier than anyone else in the state, as far as I understand. We activated our emergency operations center, started looking at our continuity of operation planning, and we actually instituted our own local orders first. Limiting the size of gatherings. And we were in contact, we reached out to the state and we were in contact with them during that time. And it was shortly after our orders went in place that safer at home guidelines went in place. So again, hindsight 2020, what we're learning is the sooner the better in a situation like this in order to get something under control. So, from where I stand, we did what we had to do and I'm glad the state jumped in when they did.
Following question then, first to Joe. Then was the extension justified, the extension that the Supreme Court threw out? Was that justified, Joe?
Yeah, I think it was for a couple of reasons. Like I can speak for Dane County, and I believe the state was doing the same. We're basing everything that we do on advice from our public health professionals. And our first and foremost goal is to save lives and stop the spread of this virus in the most effective manner in which we can. And when you look at the statewide orders, the phased reopening was just around the corner, just like it's just around the corner in Dane County. So if you look at the way it was just thrown out, and that's not, that's not Paul's fault, that's not the governor's fault, that's not anyone's fault but the Supreme Court. The way that was thrown out, it just flung the doors open. Had we been able to phase the reopening, like we're going to do in Dane County, because we only want to do this once. And we want to do it right the first time. Because if we're looking at the human toll, and the deaths and suffering and illness, and then the toll that the economic challenges have brought to people across the state, if we have a huge second spike, a second wave, it will be devastating not only to our public health, but to our economy. So had we been able to do statewide what we're going to do in Dane County, which will be dialed up slowly. We will know for sure tomorrow because we're getting the last of the data we needed. But our goal and our intention and hope here is to move to what we call phase 1 on Tuesday, where people will be able to open up non-essential businesses about 25% capacity. And then in that way, we can safely do that and then remain there for a couple of the weeks and see what happens, because we don't want to overwhelm our hospitals, our public health system. We want to be able to contact trace folks who are infected, and then begin the next phase of adjusting up once we know we have that under control. Because, we talk about businesses looking for certainty. That's certainty. That's a plan. It's based on, certain criteria, and that it's a deliberate and logical reopening versus just tossing everything out. So we're going to stay on that path in Dane County. I think it would have been beneficial if we would have been able to do that statewide also.
Paul, two questions. The extension of Safer at Home. Number one, justified. Number two, your reaction to the Supreme Court ruling, sir.
Well, when you look at the second decision to go Safer at Home for another month, I think that was the issue that a lot of us had. When we talk about, especially the COVID virus, we know that there's this 2-week window. There's a symptomatic 2-week window. And as County Exec Parisi was saying, in Waukesha County, we ramped up our contact tracing very early on. Back about the middle of March, we started working and actually transferring employees from different departments into our contact tracing opportunity. With that being said, we're able to make first contact when we get a test positive case within 24 hours. That gives us an understanding of where the spread is, what's going on with it, and really gives us a better picture of what's happening with the virus in the county. The data that we use, the information that we use to keep moving forward is what Safer at Home was originally designed for, and that was to reduce the impact on our healthcare providing agencies. This was never about eradicating the virus. This was never about not getting sick. It was about reducing how quickly people were getting sick so we didn't overburden our hospitals and cause those that are critical in individuals to not get the care they needed. We've kept it down. We've watched the hospitals and watched what's happening on a daily basis in contact with them to make sure we never go over that point. When you look at the Supreme Court ruling, I think the Supreme Court realized that, again, the question in play wasn't so much as should they have done it, it's how they did it. Did they have the ability to arbitrarily suppress the economy in the way that they did? And I think that's the challenge that we're looking at. We talk about our concerns with the virus and the impact that it's having. About the second week into the Safer at Home, into our emergency orders, we created another sub-task force in emergency operations that was looking at economic impact. At the statewide, where over 500,000 people have lost their jobs. In Waukesha County, it's just under 20,000 people. That impact caused by the virus and the reaction to the virus is going to be another long-term result that we have to deal with and have to continue to work with as we move forward on basically both fronts.
Well, when I look at the DHS numbers, guys, the number of tests in Dane County is almost 2.5 times the number of tests in Waukesha County. So I guess my question for Joe, are you satisfied with that number? It's more than 20,000 total tests, positive and negatives. And Paul, are you satisfied? A much smaller level of tests that you have that there's been enough tests conducted in Dane County. Joe, you want to go first?
Yeah, sure. And yes, I am at this point. And the reason that we are shooting for opening on Tuesday and that we didn't just, go earlier is because our number of tests available, our testing capacity was not where we wanted it to be. Our trends have been looking good. The criteria has been looking good, but we just did not have a good enough random sample of the community. So by tomorrow morning, we will have 2 weeks of those enhanced results because we stood up at the Alliant Energy Center, a mass testing site. And so that way we can move forward on Tuesday, knowing exactly where we are, not just guessing where we are. And again, I would come back to what that allows us to do is not only control the disease, but control and give certainty as we reopen our economy so we don't have to spring back. I think it's important that we remember, there's a lot of focus on reopening now, as there should be. People are hurting immensely. 36,000 unemployment claims just in Dane County alone. And it's heart-wrenching. At the same time, it's important to remember that this disease is killing 1,500 Americans a day. It's putting our elderly at risk. It is decimating African-American communities. And we're all sick of it. We're all suffering from it. Some people are suffering greatly physically, economically. But, the virus is still here. There's no vaccine. There's no cure. And we have to stick together as communities and as counties and as a state until we get through this. And it's not going to get easier anytime soon. And many of the results are truly heartbreaking. But we still are in the middle of a global pandemic. So it's a very challenging balance and needs to be a very deliberate process as we try to open up and let the economy, get going somewhat again.
Paul,
real quick though, and Steve, I hate to jump in, but one of the challenges that we have are the numbers. And I think County Exec Parisi just kind of pointed it out. He's talking about gross numbers over 1,500 of fatalities, but not the actual numbers within his county. When we look at the impact that this is having, we need to know what the net numbers are. We need to know what's actually happening today. Now, what has happened since March 1st, when as just about everybody has a cumulative number out there of total tests? What is the actual occurrence that's going on today? In the county, because of the contact tracing that we have, we know that we only have 125 active cases of those tested that are there. That gives us a better picture of what's happening with the impact on our hospitals so that we know what we can do moving forward. I would love to be able to do more testing, and we were able to finally get the National Guard to come in for 3 days. The challenge that we've had is when we're working with the state, we got 3 days worth of testing in, but the second day of our testing, they opened up test sites in Walworth County and in Milwaukee County under different requirements at all 3 sites. And so when you're looking at, as County Executive was saying, is we're looking to try to get a good sample of the individuals in our county and the individuals of the state as a whole. We weren't getting the exact same data that at the 3 counties at the same time because there were different requirements that individuals were put under. That's part of the challenge that we have. I know we're getting enough test kits now that are starting to come up that we can build it up in our county and we can build it up across the state. But the continuity of how we're putting this information together is very important as we move forward.
Well, after the Supreme Court opinion, I want to ask a question about how both of you gentlemen perceive the role of county government. Is the role of county government post-Supreme Court decision to protect citizens from others who may be infected and stopping community spread, or giving businesses and residents, consumers and clients enough information to make their own decisions? The role of county government. Paul, please.
When I look at the role of county government, it's a partnership. It's a partnership between the business community and the community as a whole. Our initial responsibility is public health and public safety. And so when we started with the impact of COVID back in March, the focus was on the highest at-risk populations, making sure that we could help keep them quarantined and keep them safe. The next step was to make sure that people understood that they've got to keep the physical distancing, they've got to keep the personal hygiene, and we have to work with them to move forward. When you look at putting orders in place, one of the challenges, and that was the challenge under the Supreme Court, can it be enforced? Even the Attorney General's opinion that came out last week admitted that most of the orders were probably not enforceable by law enforcement the way they were written. So then it's really just, again, another recommendation or a guideline to move forward on. What we did in the county is we said, okay, we're going to give you recommendations. Here's what we're doing. We're working with our business and our community partners to keep people understanding COVID virus is still here. We still need to work through it. But at the same time, we have to empower people to make the right choices and move forward together with us.
Okay, and Joe, Dane County made a different decision to come up with basically an extension of the state Safer at Home. Why did you make a different decision vis-a-vis your perception of the role of county government?
Sure. I can tell you, I've lived in this community my entire life. My parents grew up in this community. I raised my children here. And I feel personally responsible for the safety and the well-being of every single resident of Dane County. And first and foremost, my job is to protect them to the best of my ability from harm. That's the virus, that's the economic hardship, that's all the challenges that face us. Voluntary guidelines in a situation like this just don't work. We saw what happened when the Supreme Court struck down the guidelines and people crowded into bars. And the challenge is when you have a situation like that, this isn't just something that impacts the people who rush into the bars. When you had the demonstrations that were basically Donald Trump rallies with big signs and wagons with his name on it, in downtown Madison, tens of those people, 70 some people ended up testing positive 2 weeks later. Now, I want to know how many of those folks stopped at a grocery store in Madison on the way out and infected some of the people in my community. This is not just about the individual and their liberty to rush into a bar that's packed. Our actions impact our neighbors. And the guidelines, while no one is crazy about them, I certainly don't like them. And the orders we have in place, I believe, is a reflection of what my community wants me to be doing, is pulling people together, giving guidelines. Sure, there's some folks who aren't going to like it and would rather have them not be in place. But if we're going to watch out for our neighbors, if we're going to watch out for the vulnerable people in our community who are at risk of death if they contract this virus, we unfortunately, in a global pandemic, which is something we're facing, if the federal government's not going to step in, if the state government's not going to step in, I believe it's critical for the county government to step in and do everything in our power to protect our citizens.
Paul, a follow up on that. Let's see. What stat do you most rely on? Well, it's a question for both of you. You get up in the morning, and in terms of COVID-19, the stat that you want to see first, and it's a question for both of you.
Sure. The information that I get on a morning basis in the morning briefing that we have is twofold. Is again, test positives that occurred from the day before the results we got in. But the important for us is the impact in the hospitals. When we look at the number of beds, the ability for the team that's at the hospitals to do their job properly, the PPE that they have, those are the important ones for us, because as we keep telling people, we can't eradicate it, we can keep it down. And the way we do that is ensuring that the hospitals are prepared, and as County Exec Parisi kind of alluded to, making sure that our highest at-risk patients, the individuals that are most susceptible to this, which happens to be the elderly or those with underlying conditions, stay at a distance, keep quarantine. One of the things we've been working with is companies that are allowing morning hours and things like that for those individuals to come in at a safer environment. But it doesn't mean we have to shut everything down in order to do that. There's been a number of cases that you've seen across worldwide as we talk about the pandemic, where they have kept those highest at-risk populations sheltered and have been able to keep them safe without having to shut down the economies around them and cause a catastrophe in the process.
Joe, same question. Number one stat you look at in the morning, and a follow-up question. If I've been to the Dane County website, I've seen your metrics. If you don't hit your metrics next week, you're going to continue the safer at home order?
Yeah, so the metrics that we look at, that I look at every morning, is similar to what Paul looks at. I look at the infection rate, the number of positives. In fact, in the past 3 days, we've had 45 positives in Dane County. And about 25% of the positives we're having in our county are from community spread, meaning we don't know and the people don't know where they got it. That's why we don't want to, just say, game over and declare victory. So we look at many of the same things: hospital capacity, where the outbreaks are. I look at the demographics because I'm committed to not having a repeat in Dane County of what we've seen across the country, where communities of color are disproportionately impacted. I mean, that's a tragedy that doesn't get talked about enough. And what we have that's a little different than Waukesha County, when we look at our capacity for our hospital capacity, is particularly UW systems and hospital systems. We are truly a regional facility. So we can do everything in our power in Dane County, and why I wish the state order, and one of the many reasons I wish the state order could have remained into effect, but the entire region feeds into our hospital system, the counties surrounding us, even other states. So we're in a little more of a precarious position, I believe, when it comes to hospital capacity, especially when you get into those counties and those other areas that we can't control. And if they're not doing any type of phased reopening, if they're just going full speed ahead, that's worrisome to us too, because we're concerned about that increase in cases.
Both you gentlemen did your 2020 budgets last fall. Do you have an estimate of the additional COVID-19 related emergency costs that you are seeing in this budget year? And if so, do you expect reimbursements from the feds, the state, or are you going to have to pass that on to your residents? Paul?
Yeah, we're tracking the COVID. As soon as we started the emergency operations, that's part of the operational procedure is to start tracking costs related to it. When you look at the total impact that we've had at the county, there's two components. There's the salaries of the individuals that are engaged with emergency operations, and that's about $1.4 million that so far. And then there's the physical costs, which is about $290,000 so far. That's PPE replacement costs or other materials like that. The one thing to keep in mind with the salary is that salary is technically already covered in our budget because we've just shifted an individual from one location to another. Because it is the emergency related, we believe that there will be some of it that will be reimbursable under the CARES Act. We're still waiting to hear from the state how they're going to allocate the $1.7, $1.9 billion. I know the governor came out the other day with recommendations about 1.1 or 1.2 billion, but we still haven't a clear understanding of how we ask for the reimbursements yet.
Okay.
And then moving forward into our 21 budget, there is some allocation that we're going to be working on, but we think within the process we have right now, we're able to maintain it without an impact to our communities.
Joe, fiscal impact on your 2020 budget from COVID-19, sir?
Yeah, we've had literally tens of millions in expenses, some that will be reimbursed by federal dollars, some that we can use CARES Act dollar for, and some that is county dollars. We've had initiatives to partner with local farmers and Second Harvest Food Bank to help feed our residents with local food. We've had a small business relief grant program. We've had a child care center relief program. We've had an eviction prevention program, in addition to all of our emergency management expenses that we've had. In addition to that, part of our budget is funded by a 0.5% sales tax in Dane County. And this year we have over a $500 million operating budget. $68 million of that was budgeted to come from the sales tax. Now we're preparing for a $20 to $30 million hit there. So we've already instituted a hiring freeze and a voluntary furlough program. And then, all options are on the table just to get us through 2020. We're also taking quite a hit out at the Alliant Energy Center because that has not been on the levy, and that's been funded by concerts and World Dairy and all the shows that are not there anymore. So we've repurposed that. But, we have, not only for 2020, but, as Paul and others will be dealing with, 2021 will be a challenging budget season also.
Paul, do you have a number drop off in anticipated local sales tax collections?
No, because we don't have a sales tax here in the county. We're one of about 3 or 4 counties left that don't have a sales tax. So that's kind of one of the things for us is we're not seeing the loss that Joe is. That's the other, I think, thing to keep in mind is Joe is going through the different programs that he has. Because of the size of his county of roughly I think it's about 560,000 population.
546,695.
Yeah, they are getting a direct allocation of the CARES Act funding to the tune of about $90 million, where since Waukesha County is only at 400,000 in population, we have to wait and see how the state's going to do the allocation.
404,198. Paul, I apologize. I should have known you didn't have a sales tax. Let's talk about both of your local economies. We got about 5 minutes left. What percentage do you think both of your counties are, I'm going to use the trite term, back to normal? Joe, 10%, 20%, 25%, then Paul?
Yeah, I don't know how to put a percentage on it, but there's no back to normal going on here, at the moment. It's, there are some businesses, construction, infrastructure, that type of thing that's able to move forward. A lot of our tech community and biotech community is able to do a lot of their work remotely, but everyone's challenged. Even Exact Sciences, which is a very important company in our community, has switched a lot of their work to producing COVID-19 tests that are being utilized locally. So, everyone's hurting and everyone's pitching in.
What do you think, quick follow-up, Joe, what do you think the new normal will look like in Dane County?
Well, it depends on when you're talking about, right? I mean, hopefully beginning next week, we'll be at 25% capacity. If we can continue moving up in those phases, if we can keep this under control, we would be able to move up to 50, a few weeks after that. It really all depends on the virus and what happens. I'm concerned because I see, in 18 states today, their cases are increasing as many more states open up. So we're going to continue to take a very deliberate approach based on criteria. We work very closely with the business community, receiving their input and making sure they know what we're up to provide as much certainty as possible as we navigate these waters.
And Paul, any estimate what percentage of Waukesha County is, okay, I'll use the phrase again, back to normal? Or reopened?
Or reopening, as we know, the county is able to reopen a little bit sooner because of the restrictions. We didn't put any true guidelines or orders that were in place. We're partnering with our major Waukesha County Business Alliance and other organizations to get out best practices. And what we've seen, I think over the weekend, we saw a lot of people that had, built up, pent up energy that needed to release it and get out. Even in the articles that you're seeing now in the newspaper and things, it's calming down. People are realizing it. Not every single business opened up. I know a number of restaurants who have slowly opened up this week and are going to slowly open up next week, are looking at social distancing guidelines, putting proper procedures in place. They know what they need to do, but they also know what they need to do in order to be profitable and successful to keep their employees gainfully employed and moving forward as well. And I think that's what we're going to continue to see. The good news for the county is we have an incredible balance when it comes to the different sectors of employment. And they all stepped up, especially manufacturing, to retool and help out with personal protection equipment and different devices. The other thing that you've seen is a very robust change in how we do business, like we're doing right now. Telecommuting and teleconferencing has been fantastic. When I look at Waukesha County, we have 1,400 employees. Over 600 of our employees are telecommuting right now. We've been able to maintain full level of services because of the adaptability we've had and the engagement we're able to do on different platforms.
Paul, how did you feel when NBC News ran the segment from a Waukesha bar that opened up minutes after the Supreme Court order? Does that make your job harder in terms of public safety?
It does. And it's one of those, again, when you look at it, like I said, there was a lot of pent up frustration. There was a lot of energy that people wanted to get out. We've had some jokes around here. I've seen, as I work from my office and work from my house, I see people in the hallway and it's like, wow, I haven't seen a stranger in a couple of weeks. There is that creatureness that we have, the ability that we want to engage with people other than just on a flat monitor and get that energy from each other. I think we're going to see a new norm. I think people are realizing they can do that 6 feet apart and they can continue to work that way. But we had to get people to realize, as I've said before, this was never about eradicating the COVID virus. This was about maintaining a level that we could still provide the services we need as a county, both in the health ways and keeping our public safe. When you look at the survivability rate, I know a lot of times we look at mortality, but we're looking at a product here or a virus here that is a 98% survivability rate. So we have to keep that in mind, that there will be people that are going to continue to get sick. My responsibility and charge in Waukesha County is keeping those highest at risk as safe as possible while maintaining a safetiness for everybody else.
Okay, I think I have a correction. I think it was a CBS crew that showed up in that Waukesha bar. Okay, you guys have been very generous with your time. My last question is this. Lessons learned from COVID-19. Joe, please.
Act early and build resilience within your own community because you can't always depend on folks from afar.
Okay, and Paul.
I would agree with Joe, and the other one is communication. Making sure that you're pushing out information to as many people as you can to let them know what's going on. And when it comes to intergovernmental operations, making sure that you've got a good line of communication that's effective along the way.
Paul Farrow, Waukesha County Executive. Joe Parisi, Dane County Executive. Such an important issue. Thanks for this civil dialogue. Gentlemen, thanks very much. May you and your community stay safe.
Thank you.
Thank you. Likewise.
Thank you.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.